With Spotlight AI Assistant, you don't just keep notes, you stay on top of your day without missing a beat.
Hello, Ruth Miles. I'm your AI assistant. I can help you create and manage work tasks, retrieve patient information, and submit feedback about your work or patient care. What would you like to do today?
I would like to submit a feedback about a patient called Patrick Woods.
One Patrick Woods Emergency Department, desolagrace954 at gmail.com. I found one patient. To submit feedback about them, please tell me 1. The number, 1. 2. Your detailed feedback message.
The number is 1, while the feedback message is that Mr. Patrick is attentive to details and always do what I ask him to do.
Thank you for your feedback. I've successfully submitted your feedback about Patrick Woods. Feedback summary: Patrick Woods, patient, Pentiment positive, 8500. Submitted 8/11/2025, 6:06 p.m. Your feedback has been recorded and will be reviewed by the appropriate team. Thank you for helping us improve our healthcare services.
I would also like to schedule a task.
Sure thing. Let's get that task scheduled. Could you please provide the following details? 1. Title of the task. 2. Detailed description. 3. Category, e.g., patient care administration, medical, follow-up. 4. Priority level, low, medium, high, urgent. 5. Due date in YYMDD format. 6. Estimated hours to complete the task optional. 7. Tags for task organization optional. 8. Assigned to, if other than yourself, optional.
The title of the task is Meeting with Executive, while the description is Meeting with Executive about the daily stand-up meeting. The category is Administration and the priority level is Medium. The due date is 12th of August 2025.
Perfect. I've created the task meeting with executive in the administration category. The task is set to medium priority, due on 2 Aug 12, 2025, and assigned to you. The task is now pending and ready to be worked on.
You might be wondering how this all started. Well, let's take a walk through Spotlight software by Timglobal. I am Deborah Afolabi, and I'll be taking us on the walkthrough of the Spotlight software. The Spotlight software by Timglobal is an AI-powered platform designed to revolutionize how healthcare providers manage sentiment, optimize team performance, and streamline operational workflow. Compared to other popular platforms like Monday.com, Zendesk, and the likes, who focus on commercial leads and feedback loops, the Spotlight software is built from ground up for healthcare professionals, all through the lens of quality patient care. Now I'll be demonstrating to us how the website works. Upon landing on the website, users are welcomed with a clean and intuitive interface. And as an administrator, you can easily go to the sign up page and sign up your organization. So I'll be inputting my details as an administrator, my email address, my company's address, my company's name, my company's address, and I'll create a password. I'll choose a picture so which is optional. Then administrator can agree to the terms of service and privacy policy, and this is put in place in accordance to the GDPR rule as regards data protection and privacy. By agreeing to these terms of service and privacy policy, the administrator consents to the fact that the information, the data of the staff members as well as clients can be used by this platform, which implies that they have to seek the consent of their staff member and users for data that is going to be uploaded on this platform. So let us view the terms of service and privacy policy. Okay, this is contained here. The terms and conditions are contained here for the administrator to read through and understand. After that, the administrator will agree. We click on agree to the terms of service and privacy policy and create an account for his or her organization. Okay, so the account has been successfully created. So here you have to input your email address as an administrator, your password and complaint ID. And it should be noted that the complaint ID has already been sent to the administrator's email. We'll be checking that here. Okay, so we can see that here. Dear administrator, congratulations, your complaint Timglobal has been successfully registered on our healthcare platform. So this is the complaint ID. Let's copy that. So let's input the email address again, the password, then the complaint ID. Okay, so I agree to the terms of service and privacy policy. Then I can click on remember me. Then I sign in. Okay, so login successful. So upon logging in successfully, the administrator is welcomed to his or her dashboard, and we can see here it is indicated here that I am an administrator, and these are the actions I can perform on the platform. I can submit feedback, I can upload moments, I can manage workers and view analytics of sentiment and team performance. And before we go deeper into the dashboard, the first thing you will do as an administrator is to manage your workers. So now that your organization has been successfully registered, you can click on this place, either here or here, to add staff members. So you can add as many staff members as you want. The staff members working in your organization, you can add them. You can also add clients that are also making use of your organization. Now, let's add our first worker. Let's say our first worker is Ruth Mouse. Okay, her role, she's a staff member at department. Let's say she works in emergency department. Then her email address. Okay, so we can add worker here. So we've added our first worker. Ruth Mao, she's a staff in the emergency department and it is set to active. So we should note that immediately I added the worker, an email would have been sent to the worker's email address containing her login details, and we are going to see that now. This is the email of the worker. Let's refresh. Okay, so I've refreshed. We have a new email. So, dear Ruth Mouse, welcome to Timglobal. Your account has been successfully created on our healthcare platform. So these are our login details. Let's add another worker. Let's call him Steve Jacobs. He's also a staff member. Let's say he works in cardiology department. His email, let's say, okay, so let's add worker. Okay, worker added successfully. So Stephen Jacobs, a staff member from cardiology department. Okay, an email will also have been sent to him. So let's check our email and see if it has been sent to him. So I'm refreshing now. So yes, an email has been sent to him as well. Welcome to Team Global. Your account has been successfully created. So these are his login details as well. Okay, so let's add clients. Let's say our client is Patrick Patrick Woods is a client. Let's say he's from emergency department. Okay, let's say his email address. Okay, so let's add worker. Let's add him. Okay, so an email has also been sent to him. Let's check. Okay, so dear Patrick Woods, welcome to Team Global. Your account has been successfully created. So we can see the way we were able to add staff members and clients to use this platform. So all these staffs and clients have been added to Team Global, to this organization. So different administrators can come from different organizations and create an account and easily add their workers to start using the platform. Now, before we explore the staff, the administrator's dashboard, let's go and explore the staff dashboard. So now I'll log out and I'll log into Rootmouth's dashboard. Okay, so this time around, I'm not going to sign up. I'm going straight to log in as a staff since my account details have been sent to me. Okay, welcome back. So we'll be using the email address of Rootmouth as well as a temporary password which you can easily change at any time. It's just a temporary one. Then the complaints ID. This is it. To log in. So the complaints ID is unique for every for each organization that has signed up to this platform. So as a staff member, you have your dashboard where you can perform these actions. You can submit feedback, you can use the AI assistant, you can manage patients, you can you can manage your tasks, you can schedule tasks. So now let's explore the task management, the submit feedback, as well as the AI assistant. Now, I can either come here to create a task or I can come here to create a task. So now let's click on here to create a new task. Okay, let's say I want to administer medication to Mr. Patrick, who is our client. So let me describe the medication I want to administer. So administer paracetamol to ease Mr. Patrick's pain. Okay. So priority, let's say is a high priority task. The category is under patient care. Okay. The estimated date, let me leave it to 12th of August 2025, then by 9 a.m. That is when the tax will be due. So this the estimated as optional, tags optional. Now you can create tags. Okay, so the tax has been successfully created. So administer medication to Mr. Patrick, a high priority tax. The status is pending. The due date, this is the due date. We still have 16 hours left to complete the tax. Then it's under patient care. So these are the actions that can be performed. You can use this place to edit the tax if need be. So we can always edit the tax. You can use this one to mark that the tax has been done, and you can use this button to delete the tax. So now we have one total tax, one in progress, zero completed, and zero overdue. So by the time you exceed the due date, then this overdue is going to change to one to show that, oh, there is a tax that is overdue that you not done. Okay, let's go to submit feedback. So as a staff member, you can use this action. You can perform this action and submit a feedback about a colleague or a patient. Now let's submit feedback. Who should we submit feedback about? Let's submit feedback about Patrick Woods, who is a patient. Okay, so let me say my feedback. Mr. Patrick responds well to treatment and also accommodating. Okay, so let's submit this feedback. Okay, so feedback successfully submitted. So let's go to AI assistant. Okay, so this AI assistant also serves as a personal assistant by allowing you to use your voice to schedule tasks, to give feedback, and that way lessen the stress on and pressure on the staff member as regards jotting notes down. And that way the staff member can be more efficient in doing his or her work. So I will start the AI call now, and we're going to be using it to submit feedback and to also schedule a task.
Hello, Ruth Miles. I'm your AI assistant. I can help you create and manage work tasks, retrieve patient information, and submit feedback about your work or patient care. What would you like to do today?
I would like to submit a feedback about a patient called Patrick Woods.
One Patrick Woods Emergency Department, desolagrace954 at gmail.com. I found one patient. To submit feedback about them, please tell me 1. The number, 1. 2. Your detailed feedback message.
The number is 1, while the feedback message is that Mr. Patrick is attentive to details and always do what I ask him to do.
Thank you for your feedback. I've successfully submitted your feedback about Patrick Woods. Feedback summary: Patrick Woods, patient, Pentiment positive, 8500. Submitted 8/11/2025, 6:06 p.m. Your feedback has been recorded and will be reviewed by the appropriate team. Thank you for helping us improve our healthcare services.
I would also like to schedule a task.
Sure thing. Let's get that task scheduled. Could you please provide the following details? 1. Title of the task. 2. Detailed description. 3. Category, e.g., patient care administration, medical follow up. 4. Priority level, low, medium, high, urgent. 5. Due date in YYMDD format. 6. Estimated hours to complete the task optional. 7. Tags for task organization optional. 8. Assigned to, if other than yourself, optional.
The title of the task is Meeting with Executive, while the description is Meeting with Executive about the daily stand-up meeting. The category is Administration and the priority level is Medium. The due date is 12th of August 2025.
Perfect. I've created the task meeting with executive in the administration category. The task is set to medium priority, due on 2/12/2025, 2025, and assigned to you. The task is now pending and ready to be worked on.
Okay, so I've been able to demonstrate how to use the AI assistant to submit a feedback and to also schedule a task. For the feedback would have reflected in the administrator's dashboard because they want to see the feedback and also to manage the feedback. But for the tasks that we're able to um, schedule using the AI assistant, I'll be showing us here. Okay, so now we have two tasks. Before we only had a task, but while using the AI assistant, I've been able to schedule another task. So which is meeting with the executive, and the description is meeting with the executive about the daily stand-up meeting, the priority, medium, status pending, and I have 7 hours left for the task to be done. So now we've been able to explore the staff member dashboard. Now I'll be going to the client dashboard to see the actions that they can perform. Okay, now let's log into the client dashboard. This is the client's email. Okay, this is the temporary password of the client, then the complaint ID. We can see that it is the same for the administrator, for the staff member, as well as the client. Okay, we'll be signing in now. So these are the actions that the client can perform on his dashboard. It can submit feedback and it can also use the AI assistant to submit feedback about staff members or fellow patients. We'll be submitting feedback now. Okay, so let's submit feedback about let's submit feedback about a staff member. So we are submitting feedback about Stephen Jacobs. Let's say the feedback is Mr. Jacob. No, let's say Dr. Jacob is a doctor. We are assuming he's a doctor. Dr. Jacobs is Ash and doesn't take his work seriously. Okay, so let's submit feedback. Okay, feedback successfully submitted. Now let's use the AI assistant to also submit feedback. But this time around, we'll be submitting feedback about Ruth Miles.
Hello, Patrick Woods. I'm your AI assistant. I can help you submit feedback about your care experience or staff members and answer general questions. What would you like to do today?
I would like to submit a feedback about a staff member called Ruth Miles.
One Ruth Miles, Staff Emergency Department, designed by Debbie2 at gmail.com. I found one staff member. To submit feedback about them, please tell me. 1. The number. 1. 2. Your detailed feedback message.
One, the number is one. The detailed feedback message is that she's exceptionally nice and kind to me.
Thank you for your feedback. I've successfully submitted your feedback about Ruth Miles. Feedback summary about Ruth Miles Hasehund. Submitted 8/11/2025, 6 to 3 p.m. Your feedback has been recorded and will be reviewed by the appropriate team. Thank you for helping us improve our healthcare services.
Okay, I've ended the call. So now, using the AI assistance, we've been able to submit a feedback about a staff member. So let's go to the administrator dashboard. So now we've explored the staff member dashboard as well as the client dashboard. Let's go to the administrator dashboard to explore it as well. Okay, so now let's log in as an administrator now. So I'm signing in now as an administrator. Okay, so here we can submit feedback, upload moment, manage workers, and view analytics. Let's go to submit feedback. So submit feedback is also available to the administrator, because in the real sense of it, the administrator does not necessarily need to submit feedback about staff member, but instead manage the feedbacks that are being submitted. But this is present here in case staff members that have not been added to the organization's platforms, to use these platforms, can uh, easily do it with the help of the administrator. And also clients that don't have access as well can perform these actions with the help of the administrator. So the administrator can just easily come here, put in their details and the feedback that they want to give and submit it. So now let's go to the management of feedback. So now we have four total feedbacks. So remember that the staff member was able to submit through feedback. Also, the client was able to submit feedback through feedbacks as well. So three are positive, one is neutral, and one feedback is negative. So let's see the people that were able to submit feedback. So Patrick Wood submitted feedback about root mouse, and the sentiment analysis done was 95%. Then the same Patrick Woods submitted feedback about Dr. Stephen Jacobs, and we can see that the feedback adds a 20% sentiment analysis, which is bad. Then Ruth Miles, who is a staff member, submitted feedback for Patrick Woods, and the analytics shows us that it is 85%. Same Ruth Miles submitted feedback about Patrick Woods, and it was also an 85%. So we have the filter here, so we can filter by worker. So Ruth Miles has given, okay, one feedback has been given about Ruth Miles. Let's see Stephen Jacobs. One feedback has been given about him. Patrick Woods, two feedbacks has been given about him, and we can see that they are both positive. So we can use this to filter the worker. So for as many feedback that has been given about that particular worker, if we filter it here and we pick the worker, we can see all the feedbacks that have been given about the worker. Then sentiment filter, we can filter the positive ones. So we have three positive sentiments, we have no neutral, but we have one negative. Then we can also filter by date. The date the feedback was given. We can filter by the sentiment score from highest to the lowest, and we can also filter by workers name. So it's going to filter it out based on their name in alphabetical order. We can also filter from either newest to the oldest, or from the oldest to the newest. Now let's go to upload moments. So the upload moment allows one to share special moments or achievements with your team, and the AI is going to analyze the content automatically. So you can upload an image, you can upload a video content, and it's going to be analyzed to actually see the action that is being done. So let's select worker. Let's say it is Stephen Jacobs that is inside that image that is about to be uploaded. So we want to see what Mr. Jacob was actually doing in the image, and we can determine his sentiment score. Okay. Now let's share the moments. Okay, so moment has been uploaded successfully. So let's view the moments. Okay, we can see that it is 85%. So now let's see the analysis of what Dr. Stephen Jacobs was actually doing. Okay, so the image depicts a hospital setting with three individuals highlighting a moment of care and attentiveness. So we can see that Mr. Dr. Stephen Jacobs is being attentive and treating the client that is lying down. Okay, so we were able to get 85% sentiment analysis, and it is positive. It's a good one for Dr. Stephen Jacobs. So we already explored manage workers, where you can add or remove workers from the organization. Then analytics. So this is the overview of all the sentiments all the actions that have been performed. So it's going to give us a comprehensive sentiment analysis and performance insights. So the overall sentiment, we can see that this organization is actually doing well. We have 78% based on the feedback analysis. Wow. Then we have total engagement 5. So 4 feedbacks have been given and 1 moment have been uploaded. So how many team members have interacted with this platform? We have 3. Then department, we have 2 active departments. So we can add, so for as many workers that we had, we also include their department. So for now, we only have 2 departments, which is the emergency department and the cardiology department. Okay. So we have the sentiment trend for the last 30 days, 78%. Okay. So the key insight, so it has analyzed it for us. Okay, what is really going on in this organization? So we can see that it is positive. Excellent overall sentiment. Your team is performing exceptionally well with 78% positive sentiment across 5 analyzed items. Wow. So this organization is doing well, it's not doing bad. So the sentiment score, we have 1 excellent, 3 positive, then 1 is very negative. So the average sentiment is 74%. So let's see how the departments are actually performing. So emergency department, so 3 total items, so 3 actions have been performed. 90% sentiment score for emergency department. Wow. Then cardiology department has 20%. This is bad. It is not good. So we can use this analytics to actually see which department is doing well, which one needs special attention to which one needs special attention. Okay, so we can also see workers performance. So we can see that the top performer is Ruth Miles, followed by Patrick Woods, who is a client, then followed by Steven Jacobs. So a lot of work needs to be done about Steven Jacobs. So this is the overview of the analytics that has been done, and we can filter it out based on last 7 days, last 30 days, last 90 days. So we can always filter. So we can also see, this is the overview for all departments. So we can do analytics for each department. Let's see how cardiology department is doing. 78%. No, cardiology has 53%. 53. So 2 engagements so far. So 1 feedback, 1 moment, and it has 1 active user. Okay. Let's see how emergency department is doing. Emergency department has 88%. It has 3 total engagements, 2 active users. So okay, let's check workers. So we can also filter by worker. Wow. Ruth Miles has 95% sentiment. She's the top performer in this organization. Steven Jacobs, 53%. Patrick Woods, 78%. So we can use all of these to do the filtering. Then we can also use this button here to export this analytics. Okay, so we've been able to download the analytics, so we can view the overview of the sentiment of this organization. So thank you very much. We've been able to test and explore the administrator dashboard, the staff member dashboard, as well as the client dashboard. Thank you very much.